Let's bring in Dr. Lisa Cooper. She's the director of the Johns Hopkins Center for Health Equity and a professor at the Johns Hopkins Bloomberg School of Public Health. She's also the author of the upcoming book, Why Are Health Disparities Everyone's Problem? Doctor, this is an incredible morning. What's your reaction to what you're seeing?
It's so exciting. I'm thrilled to see this moment arrive. This is such a critical time in the health of our country. There are so many lives at stake, and this vaccine has incredible potential to save lives and to improve our quality of life and actually get us back to working and kids back in schools, so I'm thrilled.
Health equity is obviously your world of expertise. We know how much this pandemic has hurt the Black and brown community. But we also know from polls that distrust of the vaccine is particularly high among among African Americans. What do you think that stems from?
So, it stems from a long history of oppression in this country. And we know structural racism, where people of color have not had opportunities to live lives that are healthy and productive. There are ongoing disparities in healthcare. Many people in communities of color still remember so many egregious acts against them from the time of slavery through the Tuskegee syphilis experiment and even through current day experiences of discrimination. So it's not surprising that mistrust is there in terms of what science could do to harm people. But people need to remember that there have been lots of changes in the way science is conducted since that time to protect people from harm. So there are a lot of things in place to protect people. Scientific teams are much more racially and ethnically diverse. In fact, one of the developers of the vaccine is an African-American woman, Dr. Kizzmekia Corbett. There are scientists who are experts in community engagement who are also involved. So, there are a lot of protections in place, but the mistrust is understandable.
What do we need to do right now to help our most vulnerable communities? We know how the pandemic has hit them, but we also know come January, more and more people are going to become food insecure. They're going to lose their homes. People are losing their jobs. What do we need to do right now beyond logistics plans for the distribution of the vaccine, which is months away?
Well, I think we all need to, public health professionals, people in the media, health professionals, leaders just like Governor Andrew Cuomo need to work with community leaders, with trusted organizations, faith organizations, businesses, schools. They need to work with local celebrities, artists, anybody who is trusted in communities of color to deliver this message of how to protect themselves from getting COVID-19 and to help them to actually believe more in the safety of the vaccine. I think we need to have people who are frontline healthcare workers, like the nurse we just saw, who stepped up to the plate and gave her testimony and was willing to be a role model. So I think we all need to work together to give that story, to make sure people have accurate information and that they can make an informed decision about this. We can't force anybody to take the vaccine, and we wouldn't want to do that. I think everyone has to make their own decision, but it needs to be an informed decision, and they should seek out trusted physicians, nurses. We really need to work with people who are in those local communities who understand the concerns, be empathetic, not be judgmental, and be very clear and answer all questions.
A great way to build trust is to change policies to help all Americans. Is there an immediate policy change or government action that could help some of the most vulnerable Americans who are saying the system's never worked for me? Why is it going to work now?
Absolutely. I mean, I think the country is looking to local and national leaders to make decisions on policies, things like the economic stimulus package, things that will deliver relief to people who need housing assistance, who need unemployment benefits right now, who need to make sure their health insurance benefits are continued. So national leaders can actually act right now in a way that would engender greater trust from communities of color and actually from all communities.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.